Well, I very much welcome the publication of these 10 new standards of care and treatment for people who are living with the impact of drug use. And I really want to thank the Drug Deaths Taskforce and everyone involved in developing these new standards that are clear, accessible and actionable, because these new standards of care and treatment will be the absolute cornerstone of our national mission to save and to improve lives by ensuring that people get the right help for them at the right time. Now, my focus has always been to follow the evidence to ensure that we focus on individuals, that people are people first and foremost, and that I want to ensure that no matter where you live in Scotland, that you will get the treatment that is right for you at the time when you ask for it. So these new standards are a game changer to help us save and improve lives and deliver the right treatment for individuals across Scotland.
So the task force obviously had a number of projects around emergency response, naloxone and overdose response, but this is the major piece of work that will have a legacy in the longer term. This is what will make the difference to save lives in the longer term. So this will be a key legacy project, and engaging the wider community of care to get on board with these standards and help us deliver it will be crucial to that success.
The standards of care will definitely reduce drug-related harm, including death. And this is really important. To be sustainable, there needs to be sustained culture change and sustained system change. And for that to happen, there needs to be increased investment, there needs to be a much larger workforce capacity, and there needs to be strong commitment from the chief executives of NHS boards, local authorities, integration joint boards, and so on. People feel really excited, and we've had lots and lots of inquiries from health boards and from alcohol and drug partnerships. The partners we've been working with for the last 2 years are really keen to get on with implementing and making a difference.
We've already had some crucial legacy projects in terms of emergency care. That was around maximising naloxone and overdose response pathways. But this is the major legacy project that will make the difference in the longer term to saving lives. And it's crucial really that we get the whole community of care engaged to do that. And we thank them absolutely for their engagement so far in this process. We do feel people are really behind this, and we must capture that moving forward so that we can make the difference and save people's lives.
It's really important to emphasise that whilst implementing these new standards of care and treatment will indeed be a core task for our National Health Service, but this isn't down to the National Health Service alone. This requires a Team Scotland, an all-government approach. The role of third sector organisations who provide frontline services and grassroots services serving individuals and our communities is also important. So we all have a job to make sure that we can now move on and implement these standards as quickly as possible, because these standards will not only improve lives but ultimately they will save lives by getting people into the right treatment for them at the right time.